When bowel endometriosis is severe, sometimes a bowel resection, removing a segment of bowel, is the safest way to fully remove the disease. But like any surgery, it carries risks. Here are the main ones. Anastomotic leakage. After resection, the two ends of the bowel are joined together. This joint is called the anastomosis. A leak from this joint can cause infection, peritonitis, and may require a temporary stoma, which is a bag on the abdomen to divert stools while healing is occurring. Published rates around 5 to 7%, but in high volume expert centers for endometriosis, it's often under 1%, and our own rates reflect that. Number 2 is fistula formation, which is an abnormal tract between two organs, for example, between the bowel and bladder or bowel and vagina. This is a rare complication but can require an additional surgery to fix. Strictures, which means narrowing of the joint site, which can cause bloating, pain, or bowel obstruction. Sometimes these just require dilatation, but in some cases may require another surgery. Then you have low anterior resection syndrome, which is known as LARS. If the resection is very low near the rectum, you lose some of the reservoir function of the rectal ampulla. This can lead to increased frequency, urgency, or clustering of stools. With good surgical planning and pelvic floor rehab, these effects can often be minimized. Where robotic surgery helps for low rectal nodules, robotic platforms are a game changer. They allow us to be much more conservative and in many cases avoid full resections by precisely shaving or discoid excising these nodules. This means fewer patients need bowel resections, and when resections are unavoidable, the surgery is safer and far more controlled. Why does surgeon experience matter? Expert endometriosis centers not only have lower complication rates, but they also make better decisions about when to resect and when to use less invasive approaches. Early identification of risk factors, meticulous technique, and good post-op care make a huge difference in outcomes. Bowel resection is sometimes necessary, but in the right hands, the risks are low and the benefits can be life-changing for someone suffering from severe bowel endometriosis. Share this so patients understand. The key isn't avoiding bowel surgery at all costs, it's getting it done in the right hands.